afternoon, everyone. I am Dr. Gagan Anand. I am working as a consultant general medicine at BLK Max Super Speciality Hospital and also practicing at Paschim Vihar Ekta Apartment. So today we are going to discuss some important topic, which is high blood pressure, also called as hypertension. So what is blood pressure? Blood pressure is the pressure exerted by the blood on the wall of the arteries is known as blood pressure. So when there is abnormally high blood pressure, it is called as hypertension. So you know that hypertension is an iceberg phenomena in the community, that the people are not even aware that they are having high BP. It is a silent killer. With high BP of abnormally high BP of more than 140/90, there are high chances of kidney damage, which is known as nephropathy. It can cause cardiovascular insult, which in the form of myocardial infarction. It can cause brain stroke in the form of hemiparesis, and even it can cause blindness. So as you know, it is a silent killer. So how to prevent this blood pressure? What are the risk factors for this blood pressure? So there are several factors. First of all, we will discuss the modifiable risk factors. What are modifiable risk factors? Modifiable risk factors are those risk factors which you can modify, जो आप अपनी लाइफस्टाइल और इन सब चीज़ों से कंट्रोल कर सकते हो, खान पीन से. दैट आर कॉल्ड मॉडिफेबल रिस्क फैक्टर्स, जिसमें कि सबसे इम्पॉर्टेंट पहले डाइट है. डाइट, दैट इज डाइट विच कंटेन्स इंक्रीज सॉल्ट कैन कॉज इंक्रीज ब्लड प्रेशर. सो जो डाइट इज अ वेरी इंपॉर्टेंट रिस्क फैक्टर. सो इन फॉर हाई बीपी, फर्स्ट ऑफ ऑल you need to control on the diet. Secondly, the consumption of alcohol and smoking, these are also the very important risk factors. As you know that with the modern society, the consumption of alcohol and smoking is increasing, so it is also causing abnormally high blood pressure. The thirdly, the lifestyle, the sedentary lifestyle. The persons are more of having sedentary lifestyle. With this COVID, after the COVID situation, people are more at work from home. So this is causing obesity, abnormal sedentary lifestyles. So this is also increasing the risk factor of hypertension. So the other is the stress. The stress, as you know, that the people, one or other people are all suffering from this kind of stress. So stress is also a risk factor. And there are different ways, we will discuss later on, how the stress can be managed and how this we can control the hypertension. So so as you know that these are the modifiable risk factors, that which you can modify, that which with some intervention or some kind of effort you can change the things and you can control the blood pressure. The other is the non-modifiable risk factor. Non-modifiable risk factor is the age. As you know that increasing age can have high blood pressure. So as the age increases, the blood pressure increases, but it is not in your hand. So that is a non-modifiable risk factor. Other is the family history. If somebody in the family has a high blood pressure and if it is a genetic component is involved, then definitely there will be a high blood pressure in the siblings and the family members. So, and the third is the non-modifiable risk factor is the first of all is the age, the other is the family history, and the other is the gender. Like as you know, the males have a high risk of developing hypertension as compared to females. So these are the non-modifiable risk factor which you cannot modify. But the things you can modify is the diet, the lifestyle, the smoking cut down, the alcohol cut down, and the stress management. All these can be avoided. As you know that our lifestyle, we can talk little bit about the habits, like the whatever the preserved foods or canned fruits, these are having high salt intake, and these are having low potassium. So these canned juices or canned beverages are generally contains of high sodium levels and low potassium levels. So they are generally need to be avoided as a risk factor of hypertension. So now what are the symptoms of hypertension? As you know that hypertension is a silent killer. Most of the people in the community must have hypertension, but it is not detectable because it is a problem in which person can be asymptomatic, that he might not have any symptoms, but some persons may have symptoms. What are the symptoms of hypertension? These are headache, severe headache might be there. So in some cases there may be blurring of vision. Some cases there may be severe abnormal photophobia, that is difficulty in vision during the daylight, and sometimes there may be symptoms of nausea and vomiting also associated with this high blood pressure. So these are the mainly symptoms which one comes and show the doctor, and the screening level it is found to have high blood pressure. The other, what is the basic behind the blood pressure is of two types. It is the systolic blood pressure and the diastolic blood pressure. When we say 120/80, 120 is the systolic blood pressure and 80 is the diastolic blood pressure. So systolic blood pressure is the blood pressure which is exerted by the heart during the phase of contraction. When the heart contracts, it exerts pressure on the walls of the arteries, which is called systolic blood pressure. And diastolic blood pressure is the blood pressure which, when the heart is in the relaxation state, it is called diastolic blood pressure. So both are harmful. Even when the systolic and the diastolic blood pressure, if both are above 140/90, it is harmful. And sometimes we say that our blood pressure is 140/90. It is general that people say that मेरा तो blood pressure इतना ही रहता है डॉक्टर साहब, और मैं इतने सालों से मुझे कोई दिक्कत नहीं है. But you know that there is some kind of hypertension emergency, hypertension urgency, and a slow phase of hypertension. This is a slow phase of hypertension. Over the years can cause albuminuria, can cause retinopathy changes, can cause small vessel micro complications. And so these high blood pressure is to be managed at a very early stage. It is not we can leave as a 140/80, 90 as a normal blood pressure. So it is over the time this blood pressure increases, and this increase can suddenly lead to even hypertensive emergency, that is a life-threatening increase in the blood pressure at the times of stress, at the times of anxiety, at the time of emotional imbalance. So always keep in mind that you need to regularly visit your doctor as with the age you see that the blood pressure increases. So there is regular screening is required for the general population to visit the doctor and to check your blood pressure once. The instrument which you use to measure the blood pressure is called the sphygmomanometer. It measures the diastolic and the systolic blood pressure. So now you know that on May 17th we celebrate the World Hypertension Day. Our aim of this theme of this is to measure the blood pressure for every patient or every person in the community with a increasing age, and to control it and to try to modify the things which can control the blood pressure over the time. So now with this we will now go forward with how to manage the blood pressure. So you know there are different things like more lifestyle modification, medications, and the dietary involvement, all are there. But the major what I say is to control the blood pressure is with the lifestyle modification. What is the lifestyle modification? Is first of all the regular exercise. 30 minutes of regular exercise per day over a week would reduce the blood pressure. And this exercise could be in any form. It could be in the form of jogging, swimming, running, or doing activity, gym or treadmill. So a regular physical activity is very important. The other is important is the diet. The diet with low sodium intake. The diet with low sodium intake, like diet with rich in vegetables, grains, and fruits and salads should be taken. So diet with increase intake of the salt should be avoided. So the diet should be in such a way that you take more of the vegetables, grains, fruits and salads over the time of the day. So this is called the dash diet. The other thing is the smoking. Quitting of smoking is very important in control of blood pressure. So one who is smoking and the other is the consumption of alcohol. If one is consuming too much of alcohol and he is regularly smoking, that is to be avoided for control of the blood pressure. And the third is the sedentary lifestyle. As you know that the sedentary lifestyle can cause increase in the weight, overweight, and can cause increase in the blood pressure. So these are the various lifestyle modifications which is to be seen. The other very important is the stress management. As you know that for stress management you should take some time out of your regular activity for some kind of yoga or listening music or whatever make you happy. You take some time out of your regular routine work. So by doing all these things we can control the blood pressure. So last is the medications which are used for the treatment of hypertension. There are various medicines like the calcium channel blockers, the ACE inhibitors, the ARBs, the diuretics. Some of them are the centrally acting agents for controlling the hypertension. But these are only to be taken on the prescription of a registered medical practitioner. So you know that nothing is more important than a fit and healthy lifestyle for controlling the blood pressure. Thanks a lot. Thanks everyone.